I am Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with lifelong medication. Here we learn of the approach for a patient who was suffering from rheumatoid arthritis for the more than 30 years with joint stiffness and deformity, body pain and tiredness. And the patient is having diabetes for the last 15 years on insulin and 3 diabetic tablets also, 3 types of medicines for diabetes plus insulin. Dyslipidemia, that is cholesterol and triglyceride and all, for that she is taking medicine. And chronic liver disease, the non-alcoholic hepatitis she is diagnosed with. And scanning shows fatty liver stage grade 1. And also the renal stones, small renal stones are also there in the ultrasound scan. The patient is taking insulin twice a day on 8 different types of medicines, including tofacitinib, a new generation immunotherapy medication. In spite of all these medications, suffering from severe body pain and joint pain, she can walk up only with the help of someone in the morning. If she want to get up, she need a support actually. Here I will try to explain how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms and progress evaluation based on corresponding improvements in periodic tests. When we come to the patient's detail, she is this a lady of 61 years old and her height is 147 centimeters and weight is 50.4 kg. And her abdominal circumference is 94 centimeters and her fat percentage in the body is 43.3. Ideally, it should be around 25 for a lady, the body fat, but it is much higher, almost 20% is high. When we come to the diagnosis, she is diagnosed with rheumatoid arthritis almost 30 years back and diabetes mellitus, that is type 2 diabetes, 15 years for the last 15 years. And she is having chronic liver disease also, non-alcoholic steatohepatitis. And her liver enzymes is high and fatty liver grade 1 is there. And maybe it is an autoimmune sort of, because she is not that obesity or nothing is there. Maybe because of this, her liver problem is because of the diabetes and other problems. Or can be autoimmune also because she is having a autoimmune problem. Then dyslipidemia, that is cholesterol and triglyceride are high and she is taking medicine for that too. And on the scan there is renal stones, small renal stones also is there. She had for the last many years, over 30 years the disease is there. She has taken many and consulted many specialists on the rheumatology side and the other, especially the endocrinology side and many hospitals. And in India, traditional medicines are also there, like Ayurveda, Siddha also, and Homeo also she tried, especially for this Ayurveda and Siddha medicines and all, good for this autoimmune diseases, especially this arthritis, rheumatoid, this rheumatic disorders. But everything she has tried, but she is still on pain itself actually. When we come to the disease category, so autoimmune disease and metabolic disease, both is there. When we come to the medications, what is she is taking? She is on human mixtard, actually twice a day she is taking, and metformin twice a day, and tinagliptin 20 she is taking, and I think some vitamins also is there, food supplements. Then next is for the arthritis, she had taken many sort of things. Finally, this methotrexate and other medications she was taking, Kochi and all, because it is 30 years. So many medicines she had tried. Now she is actually on a newer generation medicine, tofacitinib. It's a kinase inhibitor, sort of a new immunomodulator actually. And rosuvastatin, she's for the cholesterol is there. Pregabalin, that is actually a painkiller, that is neurological, and this sort of multiple pain is there, no? And etoshine 90, that is also for the pain relief she's taking. And when we come to the blood reports, even with insulin and all this diabetic medicine, HbA1c is 7.4, and the C-peptide level is low. So that means it can be a type 1 diabetes. That is the diagnosis actually. And there is definitely, she's already on a type 1 diabetes, means it can be autoimmune diabetes. So the pancreas function, islet function is going down. So it should be around 1 at least. But with her this C-peptide is because she is on insulin. The insulin level is not, you cannot check the pancreatic function by the insulin level. For those patients who are taking insulin, we should check the C-peptide level. Then only we can differentiate between type 1 diabetes and type 2 diabetes. So for this, for her, C-peptide level was low. So we should take it as a type 1 diabetes then. And she's controlled, dyslipidemia are controlled with the statin. Her HSCR, the inflammatory markers, even though anti-inflammatory she's taking, the inflammatory markers were high. HSCRP 31, CRP 18 are also high. And the WBC count, that is also another marker for the inflammation. She doesn't have any infection, fever, nothing. But her WBC count is high. That also is because of this inflammation actually. Her iron level is low, and SGPT, SGOT, and the liver function is abnormal, and vitamin D level is low, and her rheumatoid factor, RA factor is high, very high, 344 is there, and this CCP also high, 75.75. And when we checked into her food and intolerances and what is the reactions and all, she is having allergy to many items like the common food in Kerala, like papaya, rice, yeast. We usually take, everyone, we use yeast for this roti and appam and all. And she's allergic to egg, almonds, cauliflower. So many items she's allergic, and also milk and milk product, all the milk products, and even some of these pulses, potato, mushroom, wheat. So many items she is allergic to. So this is actually easy for each person it will be different. Almost all the autoimmune disease and allergic patients will be having a lot of food which is commonly used will be intolerant. When we come to the symptoms, and her main problem is pain and tiredness. Pain, all the joints pain, all the body pain. Wherever you touch the pain, it is paining. And that means the muscles and the joints are affected with the, not only that, actually in rheumatism, the fascia, not only that, each muscle is covered with the fascia, no? So that joint capsule and the tendons are inflamed, and also this fascia of the muscles also will be inflamed. That is why this much of pain is there. And tiredness, because all the blood vessels are also affected, because collagen is actually, this rheumatism sort of disease is called a collagen vascular disease. It's the one type of protein which is used for the bodybuilding. It is affected actually. Then she's having stomach upset and problems also, and stiffness, joint stiffness. She's many of the joint movement joints are stiff also. And there's some deformities on the hands and small joints. That is very common with the rheumatoid arthritis patients. Next, how we manage this sort of patient in a clinically supervised lifestyle correction. So with this, when you start clinically supervised lifestyle correction, if it is type 2 diabetic patient, we stop all the diabetic medicines. But even though she is a type 1 diabetes patient, but her C-peptide level is 0.5. Even if the C-peptide level is very low, less than 1, then we cannot stop. Usually we won't be able to stop. Then if we stop all the diabetic insulin, the sugar will come up. So because she is having 0.5 is there, so that means some function is there. So we stopped all the diabetic medicines in the first day itself. But The second day, her within 24 hours, she was very diligent in following the diet and all. And the next day itself, her without the medicines, diabetes, insulin, or the type 1 diabetes, there's no meaning in giving other tablets. But for her, it was totally controlled. And even in the 8th day, her HbA1c has come down from 7.4 to 7.2 without medicine. That is 7.4 with this tablets and insulin. And without medicine, it is 7.2, it is reduced, and 15th day it is 7, and in 30th day it's 6.2, so 6.7, and 60th day HbA1c came down to 6.3, and finally on day 90 it is 6.1. Actually, usually much more faster results are there usually for the HbA1c, but her HbA1c is coming down very slowly only because she is having some anemia also. Her immune system is not functioning. That for getting HbA1c corrected, all the RBCs has to be new RBCs has to be formed. But for her system, the joint is having more problems. So the body may be shifting rather than correcting the HbA1c or the RBCs to be replaced. Maybe her joint was been given priority. That is why her even though sugar is controlled very well, the HbA1c is not that fast correcting. In this clinically supported lifestyle correction, what we try to do is to ensure that the optimal nutrition is there. Actually, for our body, there is 57 nutrients, including water and oxygen, is needed. And there is 14 vitamins, 14 minerals, around 20 amino acids, 4 fatty acids, and dietary fiber. We are trying to ensure all these nutrients for the person, plus the minimum toxins, because when the toxins enter, the body has to react for them. Already the immune system is compromised with all these medicines, and that is the why there is toxins are there, or that is why the immune system is working. And this autoimmune disease means the immune system doesn't know what to do. They are attacking our own cells actually. That is the healthy cells immune system is attacking. So that means that cell is made up of our food. So there is a problem with the food. That is why all this body is reacting to so many food that should be avoided. And also to give exercise to stimulate all the cells in our body in a systematic way to improve the circulation and also to remove the toxins already stored in our already got into our system actually. So this is a patient with so severe pain and all. So how to do that? How to go ahead with making them comfortable to do exercises and all. Even those who are on this anti-inflammatory and painkillers and all, while withdrawing time, we add a slight anti-inflammatory and painkillers also, and withdraw the other one. And within a month, we will be able to withdraw the added anti-inflammatory like dexamethasone 0.25 milligram or this NSAID group of medication, which is most, that also we check which is body, is there any reaction, because this sort of patients will be taking medication for a long time. So we find out from the test which is most suitable for them and give a very light dose. Actually, her tofacitinib we had the first week, second week onwards, and the 8th day she was reduced to 5 milligram twice to once a day, and then gradually alternate day, and then one day. And by 60th day she was taking only tofacitinib, which was taken every day twice to once a week actually, and by the 90 days she stopped of that medicine. And the statin also was 10 milligram to 5 milligram, and then alternate done weekly 2, and by 60th day it is also over. That pregabalin and the other painkillers and all stopped within the first day itself actually. What is the improvements in the blood test with this clinically supported lifestyle correction? Her SbA1c 7.42 improved to 6.1 in 90 days. And C-peptide, we suspected type 1 diabetes. C-peptide level was 0.5 and it was increased to 1.9 on the 60th day. So the type 1 status is gone. Now she's C-peptide level is 1.9 is there, and also her blood level, sugar also is controlled. If in this sort of patients, if usually 0.4, 0.5 C-peptide level or even 0.3, we will be able to improve actually. Even for this, we are suspecting an autoimmune disease. But if it is gone down, especially in children and all, the children sort of, that is very fast destroying beta cells. In such things, within 1 or 2 years of starting type 1 diabetes, the C-peptide level will go below 1. In such cases, we won't be able to revive. But if you are even in children, before this C-peptide level is going down, if we are able to stop this autoimmune process, because with this our lifestyle changes, we can stop the autoimmune process. Then if you give proper nutrition, the beta cells will start functioning properly. They have, the human body has the capacity to repair and to rebuild, because there are stem cells are there. But if the stem cells also is completely destroyed, we can't do anything. When we come to the dyslipidemia part, we are gradually reduced to the statin, but the statin, the cholesterol level is reasonably going okay, and we don't try to control, because cholesterol is made by the body. The body needs cholesterol, then body will make it. So we don't even 200 or 210, up to 250, we don't have to bother. If the triglyceride and HDL level is okay, we don't give much importance for a slightly high 220 or 210 sort of cholesterol, because the body because it's a repairing stage. Cholesterol is needed for the building of the cell. So if you are artificially trying to reduce the cholesterol level, it will affect the healing process. And WBC count, that is the inflammatory marker, WBC count came down to normal within 30 days. But HSCRP, CRP are all gradually reducing only. Actually, it is reduced gradually from 31 to 17.2. But after 60th day, it was gradually reducing. But after 90th day when she came, there was slight increase. Actually, a market increase was there. When we entered into the thing, she has gone for a tour. See, the person who was not able to get her from the bed, then we are coming, she needs the support, but she had gone for a tour for 2 weeks. And she had some idea, some food was also taken, other food which was while you are on a tour, it is not under your control now. So that was the reason for this increase. She had actually mild pain and symptoms also came, but there was some medication which is for emergency situations, mild anti-inflammatory and things is already given, so she was managing with it. She has taken other food, that is some allergic food and intolerant food she had taken. That is the reason why this increase is there. And her iron level, she has non-alcoholic steatohepatitis, NASH was there, no? That also got corrected. Actually in the 15th day itself, the SGO liver function came to normal, and her iron level was very low. That is very common with most of these patients with this rheumatism. That also got corrected. Then vitamin D level was very low. It was also, that is, we can give the supplements in. Then we come to the RF factor and anti-CCP also gradually came down to RF 344, and anti-CCP also came down. But what happened is actually after this, her trip, and she shifted from the diet and exercise, and also that also we should not. Should note that this during trip and all, you won't be able to do the exercise also. That is, the stimulation part and phased exercise and all is not possible under diet also. That is the reason why this after 60 there is a spike in the RF factor and anti-CCP, that we had to bring it down again. Now we have seen how the medicines and the has reduced, and also the lab report levels. When you come to the symptomatic relief, actually her major problem was pain, tiredness, stomach pain, stiffness, joint stiffness and all. Is the pain actually, she has a 50% reduction in by the first week, 8th day itself. In this actually we follow in the 8th day, 15th day, and then every month, 30th day, 60 day, 90 day and 180. So, and the 15th day, by the time 80% pain was over, and by 30th day 90%, and the 60 she's okay, there's not much pain. Tiredness also reduced. By 30 days the tiredness part is okay, and stomach pain after the 8th day itself she was okay. The stomach symptoms were all because the diet is changed. So when a clear diet is there, the stomach will be the first to regain health actually. After first the stomach has to regain health, and only the other part can follow because the body needs food. The nutrition has to come. So first importance is to correct the stomach. Stomach means and the intestinal system. Then stiffness of joint, there was only 40% reduction was there, and she was actually initially she was not able to lie down on the tummy, that is prone position. She cannot do that. Actually by 30th day, while she was able to lie in a prone position, and the exercises, the pattern of exercise, we call it Foxiflex, and this she can do all. Well, she was able to, by the 30 days only, she was able to do the exercises in a proper manner. So only by doing this stimulation and this joint flexibility is regaining, only she can regain her health also. But 90 days actually, by the 60th day, almost 90% flexibility is regained. Only her one of the elbows was more stiff. That was not complete. She was not able to completely straighten her elbows. Otherwise, she was fine with all the other joints. Again, when the thing is very important, I want to stress is, after she has gone for the tour and not able to do the exercises and the food, again she had some pain sort of things has returned, but she was managing with the emergency medicines which was given. But she was able to enjoy the trip and everything. Only because, some symptoms appeared, that's all. And also it was reflected in the blood tests also. We check into what has happened into your body. Actually, in clinically supported lifestyle correction, what is trying to correct is the body composition. At a macro level, that is weight and the body shape, and at micro level, the cells itself. So to correct as I said, actually the fat is controlling our body. We think that the brain is controlling, definitely brain is controlling, but brain is made of fat. That also we should understand that. So any bad fat or for the structural body building, the ideal fat is omega 3, 6 and 9. The saturated fat is good for the energy purposes. Trans fat is not good for any purpose because the body doesn't know how to handle it. If you have this, if you are eating so much of this hydrogenated fat and all, the body doesn't know how to use it properly, not even for the energy use. So it all get into the body building and into your brain and your nerves. So that will create the problem. It will make the cells aged and stiff actually. Cells, it's not only the joint stiffness, it is the cell stiffness is also, cell wall thickness also important, because the nutrition and the waste material has to go in and out. If the most flexible is the omega 3 actually. If your body has more, if your cells, not only the body, even at the micro level, if the cells having more omega 3, that means your cells are more flexible and young. And omega 3, 6 and 9, but the proportion of 6 and 3 also should be ideal. That is, ideal proportion is 1:1. In all these inflammatory diseases, what we are, with this clinically supported lifestyle correction, what we are trying to achieve is to get a body fat percentage to optimal. For a lady, it should be between 20 to 25 will be the optimal body fat level. And in that fat itself, the omega 3, 6 balance should be 1:1. That is what we are trying to achieve. For her, she's 147 centimeters and her starting weight was 50.4. And by 120 days, she was able to come down to 39.5%, 39.5 kg. So that is what, it's a very good achievement. And her BMI was 23.3, slightly above for an Indian. But she was able to come down, make it down to 18.3. That is the lowest. Actually, for the Indians, the lowest BMI is 18 and the highest is 23. But this sort of problem, especially with this much of fat inside the body, in the system, she has to come down to low normal, because it is very difficult to build up bone and muscle, but we can reduce the fat a little more faster. So we had to get rid of all the excess bad fat also. So, and the fat percentage, but was come down. It's only market, there is not much market decrease actually. 44.3 to 40.5 only, because her muscles and bone also is so weak. Now after all the symptoms is gone, now we had to rebuild her muscles and bones, and she can increase her weight to at least reduce according to the fat reduction. She can increase the muscle also, and she can go increase the weight also to up to 42 or up to 45. It may be ideal for her. Another most important thing is her body age. Actually, when we started, her body age was 65. She was only, her calendar age is 61, but 4 years accelerated aging was there. But at the end of the 120 days, her body age has come down to 52 years. So that change actually, the patient also will be feeling that. They feel much younger after this clinically. Actually, it is an anti-aging, or we can reverse the aging process. Almost all the patients with lifestyle diseases, there will be body accelerated aging will be there. That also can be reversed too. She has actually reduced her age from 65, that was 4 years accelerated aging, and by 30 days it came down to 62, and 60 days it has come down to 58, and 90 days body age has come down to 54, and 120 days 52. That means it's almost 61, the real 61 is now only 52. Actually, she will be, if she can build up gradual exercise and correct nutrition, she can build up her muscles and bone, and she can keep her body age below 50. And that is actually really the health means it is the amount, the muscle and the bone mass actually, not the fat mass. Fat mass is needed, but only 10 to 15 for the men and 20 to 25% for the ladies. If we can maintain our muscle mass and bone mass and not accumulate the fat mass, we can keep yourself young actually. Now when we summarize this patient achievement with the clinically supported lifestyle correction, actually she is symptom free. Within 30 days, major symptoms are all gone. She is comfortable. She is able to manage. She is able to do the household work and all comfortably. And by 60 days, she is able to go for a tour also. That is, for her, it is has never thought of such a thing is possible for her actually. And when the medication point of view, she was on insulin and so many medications and steroid medication, immunomodulators and insulin and so many medicines for cholesterol and diabetes and all. It is all over within 60 days. Diabetes medicine and insulin is over in the first day itself, and the others also by 60 days it is all over actually. And when we come to the blood reports, it was much better. All the blood parameters are almost correct, except for the inflammatory part and also the autoimmune antibody markers actually. So that for all the, especially this is 30 years long, no? It will take some more time for this autoimmune antibodies panels to come down. And also if there is some intolerant food or lack of exercise all comes in, it will go fluctuate also. So it is for her, it is very important to follow it for some more time, not this 120 days or 180 days. Usually in the clinically supported lifestyle correction, first importance is the first month. That is the time to get over try to get over as much as medicines as possible. Then by 90 days we should be able to get over all the medicines, except in some cases like put a stent within few months or something like that. Next is to maintain that to another 3 months, and then gradually depends on if the patient is having only diabetes and hypertension, it is easy, then they can manage. But autoimmune diseases and cancer patients, they need more follow-up because there is a long-term problems are lying down there. So the monitoring of the till this anti-CCP, RA factor and all, we had to follow it till it is normal and then see that it is kept normal also. Symptomatic, and these parameters, even though they are not symptomatic, they will not be symptoms, but the parameters is changing. That means they are doing something, some changes in the lifestyle which is not acceptable. Then immediately find out and correct it. Otherwise, we can reverse the lifestyle disease with the lifestyle moderation. Equally important is you can that disease can reappear if you start practicing the wrong lifestyle which was earlier. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases, and come out of medications. To protect your children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.